Hey there, Dr. Todd Cameron here, GP. I just want to chat to you about the rules around the booster dose of COVID-19 vaccine. So that is the third jab that you would receive for that and the details behind it. So this document that I'm working from is the recommendations on the use of a third primary dose of COVID-19 vaccine in individuals who are severely immunocompromised. Version 1, dated 7th October 2021. So you can expect updates to this document. But I'll read through some of the details and I'll try and draw your attention to where it becomes relevant for you if you think this might be relevant. So the ATAGI recommends a third dose of COVID-19 vaccine in severely immunocompromised populations to address the risk of suboptimal or non-response to the standard 2-dose schedule. So the purpose of this is to make sure that people whose immune systems don't function as well as they should get the opportunity to boost and provide a response and protection to COVID-19 infection in the event that that person is exposed to COVID-19. And ATAGI recommends that all individuals aged 12 and above, so that's the current eligible population, will, with certain conditions or on therapies leading to severe immunocompromise as defined by box 1, I'm going to get to that in a moment, receive a third primary dose of COVID-19 vaccine. So what vaccine should you receive before we talk about who should receive it? An mRNA vaccine, Pfizer or Moderna, is preferred to Vaxzevria, which is AZ for the third dose. AZ can be used as a third dose if you've had the first 2 doses and had no problems. The problem is that AZ will probably not be available in Australia beyond December. And so Moderna is only available in limited settings. So what that says is in the environment that we work in, to all intents and purposes, Pfizer is what we'll be offering our patients for the third dose, unless you have had a side effect to Pfizer and require an alternative. And both mRNA vaccines, Pfizer and Moderna, should be considered the same. So if you had a cardiac side effect, myocarditis, pericarditis on one, you would not take the other. We would do our best to get a hold of some AZ. So the recommended interval for the third dose is between 2 and 6 months after the second dose of the vaccine. So this is really important. And here you'll see that the min interval should be 4 weeks in exceptional circumstances. So that would only be where we were worsening, where we were being more aggressive with suppressing somebody's immune response. We might do it earlier, but the reality is that most people will be between 2 and 6 months. People who received their second dose more than 6 months ago should receive their third dose ASAP. So if that's you, let's get on to it. An individual with an unlisted condition should only be considered for a third dose where the treating physician has assessed the patient as having a similar level of severe immunocompromise to the conditions listed in box 1. So that's a clinical judgment, must be made by you and your treating expert. It could be your GP, it could be your immunologist, or potentially somebody else involved in your care. Individuals who are not severely immunocompromised, but who commence significant immunosuppressive therapy more than 2 weeks after the second dose of the vaccine. That means that at the time of receiving the vaccine and for 2 weeks after receiving the vaccine, you weren't on any immunosuppressive therapy, you're fine. You don't need a third dose. That's important. You do not need a blood test or antibody testing. You can safely rule out any further follow-up. We're just going based on history only. Protection from 3 primary doses in severely immunocompromised individuals may still be lower than the general population. So risk mitigation strategies such as mask wearing and social distancing, and an awareness that COVID is about shared air. So being careful about being in confined spaces with large numbers of people should continue to be used even after the receipt of the third dose. That's kind of obvious. That's like saying even once you put on your seatbelt, don't drive your car in a silly manner. Now, let's get to the list of immunocompromising conditions and therapies for which a third dose is recommended. Active hematological malignancy. This will be leukemias and leukemia-like problems that people have. Non-hematological malignancy, so other types of cancer that are not blood cancers with current active treatment, including chemotherapy, radiotherapy, and or hormonal therapy, but excluding immunotherapy with immune checkpoint inhibitors. Now, your clinician will be able to inform you of that last detail. Solid organ transplant with immunosuppressive therapy. So this would be heart, lung, liver, kidney, etc. Most of those people will be on immunosuppressive therapy, so you need to get to that booster between 2 and 6 months. And the next ones are more specific, so will require conversation, but hematopoietic stem cell transplant recipients or chimeric antigen T-cell therapy within 2 years of transplantation. That's a fairly specific subgroup. You're likely to know who you are. Immunosuppressive therapies, including high-dose corticosteroid treatment equivalent to greater than 20 milligrams per day of prednisolone for 14 days out of the month. So you're going to know if that's you. Prednisolone may be used in things such as inflammatory bowel disease. It may be used in inflammatory joint problems. It may be used in asthma in rare cases or severe cases. And then here we've got multiple immunosuppressants where the cumulative effect is considered to be severely immunosuppressive. That'll require a conversation with your doctor, with your advisors, and then selected conventional synthetic disease modifying anti-rheumatic drugs called DMARDs, and they're all listed there. The next one is biologic and targeted therapies to reduce immune response to COVID-19 vaccine, and so you'll see the list there as well. Primary immunodeficiency, including combined immunodeficiency and syndromes. Again, you should know if this is you. Advanced or untreated HIV with CD4 counts under 250 per microliter. And then we also have long-term hemodialysis and peritoneal dialysis. So people with kidney failure, again, you'll know who you are. Now, I also want to walk you through just a little bit of detail towards the end here. This document does have more detailed discussion about exactly who, and you're probably going to know if this is you. It's a reasonable number. The quote I saw was 500,000 Australians. So the safety of the third primary dose appears similar to the first and second doses. This is really important. The profile of adverse events after the third dose is similar to that of preceding doses, and studies have not reported vaccine-related serious adverse events. However, these studies were conducted in a small number of patients, and rare side effects may not have been detected. There are currently no data on the safety of the third doses of vaccine in relation to the risk of myocarditis after mRNA vaccines, or thrombosis and thrombocytopenia syndrome, TTS, after AZ. ATAGI will continue to monitor the evidence around safety of additional doses. That's really important. And this is off-label prescribing. The vaccine information itself will not describe a third dose, but ATAGI has given professional advice here. And it acknowledges that the recommendation to administer third dose is a variation from the product information from Pfizer, Moderna, and AZ. That is the end. The next page is the references. What I'd like you to do is, if this sounds like you and you're not sure, you're going to need to book a consult with your usual doctor, because they're going to have all of the information around this. If, on the other hand, this is something that you are certain is you and you're able to self-certify this, then you can do that by booking for your third dose. Just remember, it needs to be between 2 and 6 months from your second dose. So you can book that, and you can book that in any of our clinics, and we'll be able to get that done for you. And that will be updated in the immunisation registry. We look forward to getting that dose into you as soon as is possible if you are eligible. Thanks.